When I reflect on my career, I think what a wonderful series of opportunities. My life has been medicine. How I would evaluate it and how others might could be entirely different. I've read stories that when I was just a toddler, I used to take my teddy bears and open them up and pull out the cotton and put the cotton back in. I had a unique experience as a really young boy. My mother, she decided to go back to nursing. So she would invite me to come into the operating room and view the operations. Before I graduated from high school, I had actually done a vasectomy. We had this country doctor who used to do tonsillectomies and vasectomies on Saturday morning. And so Mom said, you know, come on over and you can wash up and scrub on these things. And he actually let me do a vasectomy. And so I had had a lot of experience in the operating room by the time I graduated from high school. I was always interested in developing things, looking at new technology to apply to patients, make things easier for the patient. And that has been my career, beginning early at Michigan when I worked in the dog lab there. I became intrigued with the neurosurgery department. So I saw the way that they were opening the skull. You'd make a burr hole and a burr hole, and you pass the wire between the two, and you'd go like this, like an old saw. And that's how you open the skull in those days. So I thought that is a crude way. If I'm going to be working in this area, I'm going to develop. So that's how I started to develop the sternal saw. And I went to Sears and Roebuck and I bought a saber saw. Every time we tried to do it, we injured the brain. So one evening, and we were doing some chest surgery on the dog, I opened the breastbone with one of these kind of like a knife and a mallet, and it was so hard to do. And I thought, you know, I thought, well, maybe the saw I've been trying to use here, I could use here. 3 dogs in a row. Within about 15 minutes, we had split the sternum with this saw. I was so excited. I went to the phone and I called Dr. Morris, who's a professor of cardiac surgery at the university. He was so excited, he came right over. This was on a Friday night. He said, on Tuesday, I've got a case, and he said, if you want, we can bring the saw over and we'll use it. We did it. We went down, we came across, and worked beautifully. I came from the University of Michigan, which was a pretty collegial environment. So I hadn't had a lot of difficulty dealing with my professors. But when I arrived in Houston, I found it was an entirely different environment. And Dr. DeBakey was a taskmaster. It was horrible. One Saturday morning, we were doing a carotid. So I go in the operating room. I drape for the carotid. Wait for Dr. DeBakey to come in to make the incision. He walks in, and he tears all the drapes off and throws them on the floor. He says, haven't you learned how to drape the patient yet? And you know, I didn't do anything wrong. And it got worse.
You're too slow. You know, I can't stand that. You're too slow.
On one case, I thought I was doing a pretty good job. He says, you know, you don't want to help me. He said, Dr. Diethrich, you don't want to help me. I mean, aren't you interested in this case? He said, you just don't want to help me. He said, you go over there and stand in the corner. You go stand in the corner, and maybe you can learn how we do these cases. This is the worst experience. It's humiliating. It's just humiliating. But you know, I said, I cannot let this guy beat me down. So I kept doing it. Well, Dr. Bakey is doing this very complicated valve case. He sends word out to go in and expose for a femoral popliteal bypass in room number 3. So I go in there, I've exposed here, all set to put the graft in, waiting for him to come. He has some more complications, a little delay. Well, I'm looking up at the dome, and here up in the dome are a lot of my fellow colleagues. And they're looking down, and they're going like this. Say, Ted, sew the graft in. So I did the bypass. Dr. Bakey walks in. He says, where are you? And I said, well, Dr. Bakey, I put the graft in, and the x-ray's over here. He walked over, looked at the x-ray, and walked out. That's it, I'm done. I'm fired. So we're going across the bridge that afternoon, full speed, and all of a sudden, he stops like this, and it's almost like dominoes. All these guys are... He turns to me and said, Ted, he says, tomorrow morning, he says, you're going to start operating in room number 5. The next day, I started operating there. It was like night and day. He never, ever, ever, from that time on, treated me any way except like an associate. He was testing me. The philosophy of my life has been, under no circumstances, except mediocrity. Persevere for perfection, regardless of the consequences. Accept the failures, enjoy the triumphs that also will be encountered. We were doing exciting things. It was the transplant era. The first heart transplant that DeBakey did was actually an operation that I did with him. But what he didn't know was that with John, I had developed a plan. I had this idea, and the plan was, from one donor, we could easily get 2 corneas, we could do a lung, we could do a heart, and we could do kidneys from one donor. But the idea I had was, we need to do it simultaneous. I had this all laid out, and we talked to the operating supervisor, and we had the whole program. Dr. Bakey didn't know about this. This is something I'd done on my own. We had this whole thing worked out, and we did it. We transplanted a lung, 2 kidneys, a heart, and took the cornea. So they have a press conference.
Pleasure for me to introduce to you Dr. Michael E. DeBakey.
And Dr. Bakey never mentioned that I had done this, or his associate had put this together. And I just knew at that point that I needed to find something else, because I would always be, as long as he was there, in a position where he was the head. It's fine, it's fine. But I appreciate that. And I made that decision that night that I would leave. I was confident that I needed to be someplace where I wouldn't have a lot of restrictions from the beginning, and I'd be able to develop some things very quickly that I had in my mind, and that's how it turned out. Well, I'm not surprised that I've had a lot of critics, because I have done a lot of things that one could be criticized for. I like being on the leading edge, and whatever it takes to do that, I've always done.
Dr. Diethrich?
Good evening in the studio. Can you hear us all right? Do you know who the first person that I hired for the Arizona Heart Institute? You'd never believe it, but you might believe it knowing me. Wasn't another surgeon, wasn't a cardiologist, wasn't a nurse. It was a cinematographer. In the scheme, the plan, I knew that we had to educate the public. We had to put an academic flavor in what we were doing. It doesn't do any good to develop sophisticated screening technology and be able to predict stroke and heart attack and so forth if people don't know about it. And at that time, that wasn't common. People didn't like that. The doctors didn't like that. But the public loved it. And that's what the Arizona Heart Institute is. It isn't a surgical program. It is a program that encompasses surgery and angioplasty and early detection and prevention and rehabilitation, and very active educational research programs that are moving into the new arenas like endovascular technology we're seeing today. And that's why I have been so interested in, some people say championed, what now is a movement that we call endovascular surgery. It interests me a great deal to see what's beyond. I'm always looking at how we might be able to treat a patient a different way, a better way. But when you do that, you have to face the establishment sometimes, because there will be physicians that would say this isn't the right thing to do, and it may be premature, and or maybe openly it's just wrong to do it. I have always been a team player, a team developer. That's what this is all about. When I finally leave all this, I hope that I'm not leaving something that Ted Diethrich did by himself. I hope that I leave a tradition of building and the teamwork. As I end this career, I think it's fair to say that more and more my colleagues from around the world have become my friends and endorsing me for the ideas and movements which I created.